Hey guys, Woodruff here. So today we're going to be doing a little short as a part of my longer lecture over specifically about latex allergies. So we're actually starting with a drag and drop. So in these longer lectures now, I'm breaking them up and I'm also trying to add in some next generation kind of things. As a reminder, drag and drops are like what do you call it? Select all that applies. It's like an extended select all that applies. So let's jump right into this. It looks like I have two drag and drops for latex allergies. So we're dragging and dropping the common foods related to latex allergies. So let's look at this. So when it comes to latex allergy foods, I think a lot about tropical fruits. And it's a lot of like fruits and vegetables mostly is what's I commonly associate with. It's like pretty much all fruits and vegetables, what is commonly associated when it comes to latex allergies. So turkey, I don't think meats are as commonly associated with it. Banana is a fruit. I'm going to move this over. Apple is a fruit. Melons. I'm going to end up doing this all the time. Drag and drop, don't fail me now. All right, melons. Now, yogurt is dairy. I don't think yogurt has anything to do with latex allergies, or is at least not commonly associated. Kiwi, so kind of that tropical nature. Avocados, I believe are over here. And believe it or not, potatoes too. It's raw potatoes. I don't think chocolate is. So you might be wondering here, you're like, man, you're talking about foods related to latex allergies. Like, I thought that was about gloves, other stuff. We're about to talk about this next, but yeah, there's certain foods that are related to latex allergy in the sense that if people have a latex allergy, they commonly also are allergic to certain foods and vice versa. So if people are allergic to certain foods, they commonly also are allergic to latex. That's because a lot of these fruits and vegetables listed here have a actual they have like a kind of rubber quality, or they have some of the same particles that latex has in them, the same proteins and things like that. So a lot of times this is why people that have these allergies to these foods also commonly have a latex allergy. So let's jump right in. Let's get into latex allergy. So far we've talked about different types of allergies. We've talked about allergic rhinitis. We've talked about, what else did we talk about? We talked about allergies on the skin like dermatitis or hives. We've talked about angioedema, and we just last talked about anaphylaxis. But latex allergy is kind of its own special category or topic. So a latex allergy can actually show up in two forms. It can show up as a skin reaction or a respiratory reaction, like think anaphylaxis. We're talking about this separately because latex allergies are fairly common, especially if you're a healthcare worker, because of your exposure to these products can lead to a hypersensitivity. But it's really key because this can be very serious. So what else is different about this type of allergy is, like I mentioned, there's associated foods. So if you're allergic to latex, you're also more likely to be allergic to certain foods and vice versa. And it's all about those proteins in the food that are similar to those that are in rubber. So like I mentioned, banana, shellfish, avocado, kiwi. So I guess I would say tropical foods, and then also shellfish as well. Tropical foods, fruits, a few vegetables, and shellfish. So how do we manage a latex allergy? We treat it the same as any other hypersensitivity. So we're going to manage it if it's the skin reaction like we talked about. We can do things to, of course, treat their symptoms, like different antipruritic, like lotions and things like that. If it's really severe, we could do like a steroid cream. We also can give them things to decrease their reaction, like we've talked about the diphenhydramine, things like that, that are going to decrease how much they're reacting if it's on their skin. Now, if it's anaphylaxis, we just talked about that, so I would watch my anaphylaxis video because that's too much to go over. But we would obviously treat that the same. So the big overall nursing focus for this is I need to make sure to assess specifically for an allergy to latex. So sometimes you can ask a patient, are you allergic allergic to anything, and they'll say stuff like they're allergic to the outside, like they're like, hey, I'm allergic to mold or seasonal allergies. It's like, no, is there any foods that you're allergic to? Are you specifically allergic to latex products? Because believe it or not, even if you ask someone, hey, are you allergic to anything, they may say no, even though they are allergic to something. They just don't, like, sometimes they just doesn't register for them. So that's why sometimes it's helpful to name specific things when it comes to these. And then remember to note if a patient is allergy to food. Patient has an allergy to food, that could also put them at risk for that latex allergy. We also want to use latex-free supplies when possible, because again, a lot of people don't know. And how allergic reactions work is a lot of times you're not going to have a reaction the first time, but then the second time you're exposed, you can have a massive anaphylactic reaction. It's like your body's building up a defense. It saw something come in and it said, I didn't like that, so I'm going to be ready for it the next time it comes. And that's how a serious allergic reaction can work. We want to keep work areas clean if latex products are used. So if we do have to use latex products, clean them in between patients. And then teaching wise, teach them about related food allergies. So maybe they come in, they find out they have a latex allergy, but they don't know about those foods. We want to let them know about that. Also know where latex is. And I'll tell you, like, I'm about to talk about it in the next slide, but there's a lot of things that have latex in them, or can have hidden latex. So definitely want to be aware. Medic alert bracelets are really key for these patients, because people may not know. And if let's say they found down in 911, they call 911 and ambulance arrives. If they don't know that they have a latex allergy, they could come into contact with a lot of latex products. And then if they have an anaphylactic reaction, they're probably going to need to carry an EpiPen around with them. So we have another drag and drop. So let's do this one. So drag and drop the common medical products that contain latex. Now I got to tell you here, there is a lot of them. It was actually, I had to search far and wide to find something that didn't have latex in it that would be in the hospital. Now, this is not saying that all of these things have to have latex in them. A lot of the, like I said, we've really moved extensively to a lot of latex free, but some doctors' offices and some hospitals still use some latex products. So just always good to know what could have latex in it. So it could include things like blood pressure cuffs, the tubing and the oxygen masks as well. If that tubing could have latex, so can IV tubing. I don't think bed sheets can have latex in them or commonly have latex in them. Urinary catheters for sure. Again, think a lot of tubing things. Stethoscope, the tubing on stethoscopes can be made out of latex. As well as, I almost made the whole way without doing that. Tourniquets as well. So the only thing I have on here is bed sheets. I had to work really hard to find something. So anyway, there you go. So that's, again, another drag and drop for you there. All right, so, and this is just a real quick, a list of all the things in the medical or non-medical setting that could possibly be made from latex. So just some stuff to kind of keep in mind when you're looking at these things. A lot of times these will be labeled as latex free now, but it's always great to check. Anyway, that is all I have for latex allergy. I hope this short was helpful. See you for the next one.